Hello, everyone. It's Dr. Quebeca on a special edition of Couch Talk, talking about a favorite and intimate topic that most women really don't want to talk about, but probably should. Today on Couch Talk, we have Dr. Brianne Grogan. She is a doctor of physical therapy, originally from Portland, Oregon, but currently living with her family in beautiful Rhineland region of Germany. Was inspired by her own pregnancy and postpartum struggles. Brianne chose to specialize in the field of women's health, physical therapy, with an emphasis on the diagnosis and treatment of pelvic floor disorders. In 2009, Brianne left the traditional role as a clinician and started her own fitness revolution called FemFusion Fitness. FemFusion Fitness. In addition to her focus on fitness and holistic wellness, Brianne is also a certified women's health and nutrition coach. She does not believe in one-size-fits-all diet and exercise plans, but stands by her motto for vibrant health, eat clean, and move every day. It's really simple when it comes down to it. So Brianne's new book called Lady Bits, Understand Your Body, Elevate Your Health, and Reclaim Your Spark Naturally is now available in digital and print. And I'm very excited to also be mentioned in the book as well for our sexual CPR ideas and program. And I really encourage all of you to take a look, Lady Bits. I know that these are things we really are undercover talking about. And it's important to get it from reliable, healthy, holistic, wholesome sources. Dr. Brianne, it's great to have you here with us today.
Wonderful to be here. Thank you so much. This is an honor. Mm-hmm.
Well, likewise. And coming from Germany, it's nice to be able to see you. And over here in St. Simon's Island, just across the ocean.
Across the pond.
Across the pond, exactly. So tell us a little bit about your journey, how you came to write your book, Lady Bits, which of course I love the title, being traveling to England and Australia and having that English terminology.
Exactly. Yes. Lady Bits. There's just so many reasons I wrote this book, but I'd say it mainly comes down to the point that I really wanted to just share some basic health information with women, information that I had noticed when I was practicing in the clinic as a physical therapist. I'm no longer in the clinic. I'm mainly focusing on my fitness and holistic wellness side of my business. But when I was in the clinic, there were several things that women had no idea that there was help for, that they weren't the only ones dealing with certain problems. And so I really wanted to bring that to light. And then I had my own health journey. I think that so many of us who write books or, are in the wellness field, we have all struggled with our own issues. And so I really felt called to kind of share that in my book and to just, again, let people know that they're not alone, they're not weird, they're normal, there's help.
Absolutely. And I think what I like too about your messaging is that you also, as we have in our Sexy Younger You program, my colleague and I, we really wanted to take the word sexy back. So define sexy from your view.
Oh my gosh, sexy is all about the inside. It's not about the outside. It's all about how you feel and about your confidence, really. I mean, it's really just confidence. And so and just the glow from the inside out that you can portray when you're doing what you need for your individual body to feel your best, to live your best, healthiest life. So it's different for most people, but really it's just an individual thing and it's all about confidence.
I agree. And I like one definition I've read was you're magnificent, healthy, vibrant, energetic. And as we reclaim our health, right, we have this magnetism and discernment that we need always to have with reclaiming our sexy. I think that's really important because we can magnetize positive and negative, but the more focused we are, we really magnetize and emanate that positiveness. And it's hard to feel sexy when you're having pelvic pain.
Oh my gosh, yes, so hard. That's just the pelvic pain, bladder leakage. I mean, all of these things that many women deal with. And again, that's just so huge of my book, and my message is it's okay. Let's talk about this stuff. This stuff happens. So let's talk about it so that we can then overcome it and deal with it and be our most confident selves, so we can shine from the inside out and radiate that sex appeal to our partners and just to the world at large. You know, you don't have to be sexy to your neighbor down the street, but there is a confidence and a way about you that you can have that is just sort of it's an attitude. So that everyone will notice.
Yeah. So let's talk about these things, because, you know, we lose that sense with our feminine anatomy, right? With our lady bits, we lose that sense of connection when we are having this bladder leakage, pelvic pain, vaginal dryness, discharge, pain with sex, constipation. We feel like, hey, you know, do my lady bits look abnormal, versus embracing our unique identity and our unique anatomy. So let's talk about some things that you do to, you know, how do you address this with your clients, and what are some tips that you give in dealing with it?
Yeah, I mean, one of the main things is just knowing the anatomical terms and definitions and where things actually are, because a lot of us don't actually know. There was a study that I quoted in my book that it was half of women who are 26 to 35 years old were not able to identify the vagina on a diagram, and it's kind of a scary statistic. I don't think it was a large scale study, but still, I thought, well, this is relevant, because that age range in particular is, I mean, the age when people are in their reproductive years. And I mean, really, you need to know your anatomy. And so the first thing we talk about that I like to tell people about in my book, and then I would tell my clients about, is just getting to know their anatomy, getting to know the terms, getting to know where everything is, getting to know more about your menstrual cycle, that kind of thing. Actually taking a look, actually touching, actually feeling with your hands, just really getting intimate with yourself. I always say that you should know yourself better than your partner does, know your body better than your partner does. And I think that a lot of women don't. They just, I don't know, it's almost like they've given up control of their body to their partner, and really, it shouldn't be that way. I don't like using the word should, but I'm going to have to in this case.
Or hands off, right? Don't identify, don't feel good. Okay, you know, this is a temporary interaction, and, you know, I don't want to know any more about it, versus claiming it and owning, right? Owning our femininity, owning our feminine anatomy, and also claiming it. And, you know, we just, you know, there's the protection, and there's the maintenance, and there's the genuine care and lovingness, right? We are, I mean, that's a huge, huge energetic point in traditional medicine, traditional healing techniques. Our energy in our pelvic floor is hugely powerful. So having a good connection with it, but also understanding where there's a disconnect. I want to show, I pulled out your book to show, in the diagram of, you know, and I'm a gynecologist, so I love anatomy. And, you know, looking at the pubic bone, and if people listening, you can just feel down to your pubic bone, the hard bone, and directly under, you're going to have your urethra. That's the first hole you get to. And then the second is the vagina. And then the third is the rectum. And it's important to understand it's all part of healthy pelvic floor and healthy maintenance. Why we get bladder infections after intercourse, or why is there a discharge, and, you know, issues with constipation or rectal pain, or even fecal incontinence becomes an issue too. So understanding that it's all connected, close proximity.
Yes.
And care is really important.
Yeah, and one thing that I like to talk about and bring up is pelvic organ prolapse, which is something that I think a lot of women, it's a very common condition, but it's something that I think is even less talked about than incontinence and bladder leakage. True. And I think that sometimes we as a society have started to almost even make light of bladder leakage. And that's, it started to be talked about and even joked about, and there's incontinence protection and that kind of thing. But I think that prolapse, which is when the pelvic organs hang a little low, is sort of my easy definition of it, is something that women don't really always know even what is going on, what that is, that it could be something that they may have to look forward to in their future, and that there are things they can do to prevent it. So as far as anatomy, that's another thing, is I like to talk about the anatomy, but then things that can happen down the line and things you can do to helpfully prevent those things from happening.
Absolutely. And I want to just entice our listeners to make sure you go to my Couch Talk page, so KebeccaHealth.com/Couch Talk, and you'll be able to get a couple free gifts that Brianne is sharing with you. So I want to encourage you to go to KebeccaHealth.com/Couch Talk, and there are a couple links there that will send you to her free gifts, including 4 free feel-good workouts, as well as 2 chapters of her book, Lady Bits. Again, I want to encourage you to get her book, which is on Amazon as well. So, Dr. Brianne, tell us about, in your book, you talk about zipping up, and in your video. So tell us what that means.
Well, it's just the most important thing as far as really using your core muscles effectively when you are doing focused core strengthening exercises, and also when you're doing things such as lifting. All of us lift things, and those of us who are mothers all have had experiences having to lift babies over and over and over again throughout the day, sometimes for years. We're lifting babies, and something that's really important to do is engaging your core, not just to protect your back, that is a piece of it, but also to protect your pelvic floor and to prevent that downward pressure that can happen when you're hoisting something up. So zipping up involves engaging your core muscles, and the core is more than just the abs, the abdominal muscles. It includes the pelvic floor, the abs, the back, really the hips are in there too, and then the breathing diaphragm. So you want to zip up, which means to pretend like you're putting on a pair of high-waisted jeans, like really high-waisted 70s style jeans, and you're starting down low at the base of that zipper, and that's engaging your pelvic floor. So very gentle lift of the pelvic floor muscles. And then you're pulling gently in and up with your deep abdominals, like you're really zipping on those jeans. And then you want to make sure that you don't thrust your rib cage forward when you do that. So you want to button that top button to kind of pull your lower ribs in, because the alignment there is actually really important, that you want to have the lower ribs and the front tips of the pelvis, the anterior superior iliac spines of the pelvis, in line, as well as the pubic bone. Everything wants to really be in line here. You don't want this to be happening, and you certainly don't want this to be happening. So it's really all about engaging the core muscles from the bottom up and holding it in proper alignment. And that's what the zipping up is all about.
Well, I like that visual. And also we have this video for our podcast listeners on YouTube. Also, Google us and get us there. Now, that also, this part of zipping up leads to a flatter tummy, a perkier booty. Tell us how.
Yeah, absolutely. I mean, definitely, when you're really focusing on that zipping up during your focused core strengthening, you don't need to zip up all day long. I want to first clear the air there. This doesn't need to be something you need to be walking around holding all day. But when you're doing your focused core work, it's really important to be targeting the right muscles. And when you're targeting those deep abdominals that go around your waist like a corset, you're going to be doing the best work for creating a real flat tummy. And when you're not letting your ribs thrust forward then and pulling everything in, that's helping to make sure that the correct muscles are being activated when you're doing your focused core work. So it really does make a difference. The other key is to, again, be zipped up and making sure you're using those right muscles when you're doing really traditional exercises such as abdominal crunches, and not. There are lots of other ab exercises you can do besides abdominal crunches, and I give quite a few examples in my book and on my videos on YouTube and stuff, but a lot of people still do crunches. So just make sure when you are doing crunches that you're not letting your belly pooch up, because that happens all the time. I see it, and all the time. I've been to so many fitness classes, and so many times, unfortunately, have not heard the instructor tell people to pull in as they're crunching and to exhale as they're crunching, because that really helps pull in and engage the right muscles. When everything's pooching up, you're basically setting your muscles in the wrong position, in kind of a poochy position. So it's also not good if you have diastasis recti, which is a very common condition where the rectus abdominis muscles split. The connective tissue underneath loosens and gets, there's lack of integrity there. So that's a very common condition, and zipping up can help heal that as well. So there's just lots of reasons to really understand what you're doing when you're doing your core moves. That's just really a huge part of it too, is just body awareness, improving your own awareness of what's going on in your core, in your pelvic floor, in your abs, feeling it and getting that brain-body connection so you know what it is that you're doing. You're not just flipping through a bunch of crunches. So.
Yeah, that's an excellent point. I know with that different abdominal exercises, different squatting techniques were actually causing an intense amount of measurable pressure on the pelvic floor, which leads to prolapse. And we talked about that weakening of the pelvic floor. I want to let our listeners know, if you've had prolapse, incontinence, and certainly weakness, vaginal dryness, etc., that there are treatments. I've been, in my medical practice prescribing vaginal hormone therapies. And for our listeners who want to be on the first of the list for my DHEA vulvar rejuvenation cream, please send an email to gims@quebecahealth.com and we'll get you on that list for the first issue. That cream is coming out soon. But a little bit of hormones can go a long way. So your gynecologist can prescribe pelvic floor vaginal DHEA or testosterone, even progesterone, to help build muscle in the pelvic floor. When you've lost that integrity, you've lost that weakness. Now, if there's fascial damage, it's hard. But with all the incontinence procedures that are being performed and all the consequences and painful consequences after the fact, a little bit of prevention and even preoperative therapy with vaginal hormones it changes the game completely. And in my practice, I remember at one point doing 6 surgical slings for urinary incontinence in one day. And I started using vaginal hormones, and I hadn't had to do maybe 1 in 3 years after that. So it makes a huge measurable difference in the pelvic floor. There's hope. So for vaginal dryness, prolapse, incontinence, there's a lot we can do non-surgically that's available. You just have to find someone who knows. And in my experience too, with being able to get this out to the masses, right, the prescribing patterns are different, difficult finding a physician. So using a vulvar DHA cream that works on the pelvic floor and then can also penetrate the circulation a little bit can also help with that. And with your exercises, it's an excellent combination. So let's give a couple examples or talk a little bit more about the exercises to help with incontinence and the pelvic floor for prolapse. And what that feels like for women too is at the end of the day, you feel heavier in your pelvis than you do at the beginning of the day. And many patients come in saying, I just feel like something's falling out, or I just have this heaviness, but it's, in questioning, it's mostly towards the end of the day. So we have to look, how are you sitting? How are you standing? How is your posture? What are you doing to consciously rebuild that pelvic floor? So share with us some techniques.
Oh my gosh. Okay. Well, you hit on, it's a multifaceted approach here. So like you just said, body mechanics are huge. You've got to be doing your exercises correctly and not like just completely not thinking about your pelvic floor and zipping up when you're lifting weights or squatting or that kind of thing. You've got to think about body mechanics when you're lifting. You've got to zip up. You've got to maintain that proper posture so that you're not tucking your bottom under or doing something that would put a lot of downward pressure on your pelvic organs. You've got to be having regular bowel movements so you're not pushing every time you have to go to the bathroom, so you're not straining. So you've got to keep yourself regular. But as far as exercise, there is just a ton you can do. And really, the thing is, a lot of people will think of Kegels initially, and Kegels are good for many people. I'm careful with this because there are some people for whom Kegels are actually not okay. Some people have hyperactive, very tense, painful pelvic floor muscles. It's too much. And so they actually need to learn to relax before they can start effectively strengthening the pelvic floor, contracting and relaxing. So I think Kegels I've seen them work wonders when I was in the clinic and with just personal interactions, even with myself. They've worked great, but you have to do them right. And so in addition to Kegels, where you are squeezing and lifting gently your pelvic floor and then fully relaxing, again, those aren't okay for everybody, but exercises that are good for almost everybody include butt exercises. You've got to get your butt going. You've got to get your glutes firing. So you can do a lot of great squats, again, zipping up your core muscles and doing good, regular squats where you're just going down, sitting way back and then coming on up. You can actually do a squat stretch where you're coming all the way down low and just holding a nice deep squat stretch. You can do focused glute work like leg lifts and that kind of thing. That's not quite as functional as squats, but it's still a good exercise. You can do, I have a great exercise called the Hip Activator series where you're actually lying on your back. You have your feet together, your knees are bent, your feet are together. You drop your knees apart. You engage your pelvic floor and your core muscles, and you lift your butt off the ground. And you hold it there. So it's kind of like a butterfly position where your bottom is off the ground, your core is strong and engaged, your spine is long, so your back isn't arching, and you're just holding it there. That's activating the entire core, the inner thighs, which help overflow to activate the pelvic floor, the glutes, the hip rotators, which overflow to activate the pelvic floor, the deep abs. All of those great deep core muscles really activate the pelvic floor. It all works together. And so that's a wonderful exercise you can do, and just holding that for up to 2 minutes.
So you do your feet together as if you're doing a bridge, right? So
as if you're doing a bridge. Mm-hmm.
Together,
and then
let your knees go open, and then lift your bottom up, contract
yes.
the pelvic floor, and hold it for up to 2 minutes.
Yes, and that's described in my book. I call it the Hip Activator series. It is actually something I learned from my yoga teacher. It's all kind of an amalgam of things I've learned from here and there and everywhere. Some of my own things that are original moves that are original. Some are taken from other disciplines, other teachers, other people like that. This is one that I learned from my yoga teacher, and I thought it was just fantastic. It just activates everything. And it's very safe for the pelvic floor. Your hips are elevated. So it's actually kind of allowing everything to fall back down into place. I hope this is making sense. The position is sort of a bridge-like position. So everything's going down with gravity toward back into where it should be. If you have prolapse. Yeah. We'll have to describe that one. Maybe I'll link to a clip of it. But, and just a bridge exercise is wonderful where your hips are lifted off the ground. And again, that utilizes gravity to kind of pull the pelvic organs back into place. If you have prolapse, it's a really comfortable position as well. Other than as an exercise, you can just rest your hips on a couple of pillows at the end of the day and let the pelvic organs kind of come back into place and just rest there, not working, not using your glutes or your legs to keep your hips up, just resting with your hips on pillows. And again, that allows everything just kind of come back into place so the pelvic organs are not pressing down on the pelvic floor.
That is a really important concept too, is this hip activation and hip opening exercises, because one of the most debilitating things for women and men when we get older are, damage to the hip replacements, debilitating, incapacitating, and it's often, I would say, and the majority of times, a downward spiral. And one of our, as women, setups for that hip replacement is continuously crossing our leg. So we have to do the reverse, because here we're taking our legs, crossing them, rotating our hip bones and our joints outward. when we need to, again, open it, keep that flexibility and keep that limberness, consistent through time, so that we don't have adhesions in this direction. So all of a sudden you fall, which I fell off my horse yesterday and totally straddled sideways off her. So I'm totally recognizing that I'm not doing enough hip opening exercises, but that could definitely, something like that type of fall can lead to need for hip replacement or even a broken bone for sure. So that's important to understand. So opening and decreasing adhesions as they form in the hip sockets from constantly sitting and crossing our legs inward versus outward. And that's an important point you bring up, that hip activation. Excellent addition to our regimens.
Yeah. And the crossing the legs is actually a really important thing that you're bringing up, just on kind of a separate but related note, which is just repeatedly doing something in one direction. Usually people cross their legs always on the same side, always crossing the right over the left or vice versa. Anytime you're always doing something on one side, it's gonna jack you up, it's gonna make your alignment become off. And so, just really, like you're saying, bringing awareness to your body and opening things up, switching things up, making sure that you're balanced is really important for your long-term health and just long-term consequences.
Yeah. And your exercise that you showed us in that deep squat all the way down, even resting up against a wall, right? Just to keep that stretch. Now, should you be pulling up on your pelvic floor, zippering up when you're in that squat?
Gently engaged. It's going to be naturally activated anyway, but it's actually a really nice position to feel the pelvic floor. You can really nicely sense the pelvic floor muscles. Practice. I actually have people engaging their pelvic floor and then relaxing their pelvic floor in that position. It's a really nice position to feel because the muscles are on slight stretch. And so you can feel a nice contraction and then a nice release, which is really, again, key, since there is that subset of people, and can actually be quite a few people actually carry too much tension in that area. So it's important to really feel that release.
So true.
Again, I keep saying it, but it really all comes back to getting to know your body and improving body awareness and really understanding what areas of your body feel like, the muscles, your anatomy, just how they feel in you, and what's normal, what's not.
So Brianne, give us 2 exercises for women to do for the pelvic floor, again, in summary, that we should do every day, 3 times a week, and a couple key exercises that we should do, especially as we get older.
Okay. Yeah. I'm going to give you my favorite one. This is definitely an everyday thing for me, is hip circles. Hip circles are huge. Hip circles are wonderful. I am a huge promoter of hip circles. Essentially what you're going to do, this is not focused on your pelvic floor, but it's really activating all of the muscles in your hips and pelvis, even your low back and your abdominals as well. So that whole lower area of your core. So I know that this is a podcast, and I think there's some video action too, so not everyone can see me. But you basically draw a circle on the floor beneath you with your hips. It's very simple, but it's something that many people don't really ever do. And so it can feel weird. But that's one great reason to do it, because it gets you out of that straight, plain, linear movement pattern of, walking is wonderful. Walking is probably my other exercise to do every day. Okay. Walking is great. It uses all of your muscles. It really activates the glutes. It activates everything in the hips. It's so good for your heart, your entire body, circulation, everything. But it's pretty straight ahead. So between walking, which is a big activity for people, and then sitting, which is a huge activity, unfortunately, for people, we're not doing much to kind of get out of that straight ahead linear, movement pattern. So hip circles will have you going around in a big circle. You're tracing a circle on the floor beneath you. You can really use your abdominals, make the circle small and controlled. And then you can also loosen up and just be free and make the circles nice and big. keeping your shoulders fairly still and really just moving the lower part of the body. So the hips. So I love hip circles. Personally, I do hip circles every morning. And I would say there's something that any woman, I have a hard time saying any because blanket statements are difficult to make, especially as medical providers. We don't like to do that, but they're very safe and they're very effective. They also help stimulate digestion, which is huge. So yeah, hip circles and walking. I also love squatting. And for many women, I think that a few Kegels are good to do a couple, 3 times a week.
Okay, excellent. And I think that's true. Initially, when I was in gynecology and working also with pregnant mom, right? I was like, okay, give yourself a trigger. Every time you're at a stop sign or hear the water run, just think about contracting your pelvic floor. But true, like anything, you don't want to do it continuously all day. Intermittent, all our muscles need rest. But if you focus on the activity, I agree, 3 times a week, like have a focused time. Okay, this is my Kegel time. Or I hate to say Kegel, pelvic floor exercises. I'm like, I can't give, an honor for our pelvic floor. Naming an exercise. So pubic coccygeal muscle exercises, pelvic, you're zipping up exercises. Yeah. And that's a beautiful thing. And plus those hip rest circles, and I forgot about those. We definitely have to do those. It's like belly dancing, add some good music. It's fun, great way to start the day.
And it's kind of sexy. Like it's a little bit, men can do this too. Men can, but it's very feminine. It's a very flowing, just a fun, free movement. And I just think it feels good. And it always brings a smile to my face and it just starts my day off really nicely.
I like that. I like that a lot. That's a great one. And so between our hip circles, having good walks, and the squatting for the hip and the hip opening, gosh, you've given us a lot of great stuff. The hip opening, because men have it easy, right? We have to cross our legs, better maybe to cross our ankles, right? Tucked behind us, the feminine seat. But men get to put their, foot across their knee and open up their hips, right? They can sit that way. Not so good for us. But when we get a chance to sit Indian style or cross-legged and do this hip opening exercise, I can't emphasize how important that is, especially to protect the hips and improve flexibility and keep those joints beautiful, liquid, and mobile throughout our life. It's huge. Now, I want to go over a couple parts of lady bits with our listeners too. Brianne, share with us, a couple case examples and the importance of caring for our lady bits.
Well, certain things. One that just comes to mind right now is a woman. There's so many examples. Do you mean examples from my book or examples from anything?
Anything you want to share. Yeah.
Anything. Okay. Well, I think that one would be a client and a friend of mine. She's become a good friend. Underwent a hysterectomy and sling procedure and a big surgical intervention for some issues she was having, including prolapse. And she felt very much that she didn't have the information she needed before going into that. I think every medical interaction, every provider is different, but it's important to ask all the questions to see perhaps if there's anything that might be tried that is more of a conservative method of treatment before moving on to that. If you have any questions, you really need to have all the information and the facts, because she was upset afterwards. She was upset that she had gone through such a big procedure, an really invasive procedure, a major procedure, when it's possible that there could have been other things she could have tried, because that was never brought up to her. The other options were never brought up to her. And it's possible that she was too far advanced in her prolapse and incontinence to benefit from those more conservative options. But we'll never know, because it was just jumped to. And so I think that's a really kind of a heart-wrenching one, that it's an undoable thing. And, you know, she can't go back. She's had the hysterectomy, she's had the procedures, and she's okay. She's doing fine, but there has been some changes. The more kind of rapid aging of the vagina, the vaginal dryness, the hormonal issues that happen from having the hysterectomy, you know, quite young, really. And in some cases, again, it's absolutely necessary. But in other cases, maybe there are other options that can be explored. And so that's one thing as far as knowing your lady bits and understanding your body and just having confidence in yourself as a woman and ownership over your body. It can help you make informed decisions when you're going to the doctor or just making any type of decisions about your health.
Yeah, no, this point is so really important to make, especially as a gynecologist and having performed all these procedures and then learning the integrative ways and holistic ways, because even after that procedure, we didn't get to the underlying issues that caused the problem to begin with. So unless we now do the things that we should do before surgery, like the pelvic floor exercises, maybe the vaginal hormone therapy, the dietary changes, right? A very healthy, high healthy fats and high protein and low in carbs and good fermented foods, the vaginal microbiota, right? The healthy bacteria that lives within our vagina is important to healing and repairing, and often is part of the problem when, you know, the GI tract, etc. All of that is part of the problem when we have problems with our lady bits. So, you know, understanding that is really important. And then, so the pelvic floor exercises, the understanding too that if you're having, example, postpartum prolapse, that will get better over time. So there's nothing we have to do right away, you know, unless there's a severe prolapse, 3rd degree, we call it 4th degree, and we have a whole way to measure that in gynecology. But if there's a severe, we can still use temporarily, we can still use a pessary. On my website, I sell, you know, vaginal weighted balls to use in the vagina to just start strengthening the pelvic floor. And I'd love your take on those. But I found those to be useful in just passive stimulation of the muscle as we're using either vaginal hormone or even coconut oil vaginally, or ghee, purified butter from grass-fed cows, butter, you know, all that stuff, purified ghee vaginally as well. And that can help restore part of the lining and help you focus on repairing the pelvic floor. So there's a lot we can do conservatively to say, okay, we did all these things and we don't have the results that we want. Now we need to do a repair. But then we're dealing with healthy tissue, healthy muscle, healthy fascia, and your repair will be better.
Yes, it's like that's huge. And that's prehab, you know, it's pre-rehab. It's doing it before the surgery instead of just after the surgery, which many people don't even do it after the surgery. But just like anything with a knee replacement or a hip replacement, it's important to do prehab, not just rehab. So yeah, that's a great point you make about another reason for trying conservative first is improving the integrity of everything. So yeah, my take on vaginal weights or the balls is that really they can help to, again, improve that body awareness and give you that tactile biofeedback, that sensory biofeedback about what it is that they're supposed to be feeling. That sensation of pulling the marble into their body can really help know that they're doing the Kegel correctly or not. So I think that's the biggest benefit for those types of devices, absolutely. And I think, though, that they can, especially you have to be careful that they're not being used on someone with the hyperactive pelvic floor muscles and then causing more tension and potentially more dysfunction there. So that's kind of a case-by-case situation, or just something where someone has to really know their body. And
so true. And let's talk, hyperactive pelvic floor muscles are more on the rarity versus relaxed and atrophic and worn out and prolapse. But let's talk about that, because women who have it can seek treatment for years, you know, and I saw this one client I was consulting with, a doctor in Tampa, and she'd been around the nation with pelvic floor pain, spasms, you know, and I evaluated her, 2 fingers in the vagina to feel the pelvic floor muscles, and just applying direct pressure lets the muscle relax. and she was able to feel that relaxation and her pain was gone. Now that's something she had to keep doing, teach her husband to do that for her and with her, or learn to do it herself. But if partner was willing and taught him to do it with her, just to relax the pelvic floor, especially prior to intercourse, because often they can't have intercourse because of vaginal spasms and the pain. So teaching that technique, just that pelvic floor relaxation and a little bit of pressure, just as if you had a spasm in your deltoid muscle or anywhere else in your body, you would apply pressure to relax that muscle, and the same with the pelvic floor. So I have seen many cases of that where they end up having surgery. I think it's because it's pelvic pain or endometriosis, and it's not, or none of those things. It's actually spasm, which can also cause either constipation and diarrhea. It's all innervated in the same region, and important to be aware of that.
Definitely. Another case study, not from my book, but from my work as a physical therapist. Many of my patients were there for pain with intercourse and pelvic pain. And a young woman that came to me was recently married, and she had not had sex before marriage. And when they did get married, she couldn't have sex. I mean, it was impossible. And because of the spasm and the pain in the pelvic floor muscles. And so we did exactly what you're talking about. The women's health physical therapy specialty is trained in the release of the pelvic floor muscles, internal release of the pelvic floor like you're describing. And we taught her husband how to help as well. And because all she wanted was to have a baby. But she became pregnant soon after we successfully treated her condition. So that really felt great, because she could not have sex before we started this treatment. And so it's just, again, something that women need to know, that there is help, and that it does happen. It's not necessarily a common condition, but it is a common condition. It's not that most people have this condition, but it's still a very common condition. And you're not weird or an outlier if you have something like this.
That's so true, right? And then again, it's so important to understand your own anatomy, understand your own natural response to touch, to interaction, what pleases you, what doesn't please you. You can't compare with anyone else's experience. It's self-exploration, self-discovery, and communication too. When we talk about, and you bring up the issue again, in being comfortable in your sexual relationship. And it's so important because our spouse wants to please us, right? And being able to understand what feels good, what doesn't feel good, communicate it, and also express yourself. Do you want to touch on that a little bit, Brianne?
Oh gosh. Not quite the last third, but a large portion of my book is related specifically to sex and sexuality specifically. And again, it really is just what you just said. It's getting in touch with your own body and expressing your own femininity and whatever that means to you, and loving yourself in your own skin. So body image is addressed and touched on, and learning to accept yourself exactly as you are, and just really bringing that into the bedroom can really, really help. So there's that aspect. And then there's also there's some physical techniques that you can do in the bedroom to help spark things up as well. So if you are one of the people that can handle Kegels, pelvic floor contractions, there's some techniques that you can use to help with stimulation during sex that is described in the book as well. So.
Well, I am thrilled to talk with you, and thank you for joining us from Germany. I know it's late in the day for you. I want to encourage our listeners, lady bits, get comfortable with your pelvic anatomy and really reclaiming your health and reclaim your sexy. That's so beautifully important. Mm-hmm. Please check out Brianne's website, femfusionfitness.com. Brianne, tell us also a little bit more how people can interact with you, get your videos, and we'll put links on our YouTube page, our Couch Talk page. And if you are listening via iTunes podcast, please tune in there. Check out KebeccaHealth.com/Couch Talk to also be on our email list for future episodes.
Yeah. Well, for my free gifts that I would love to offer your audience, I have 4 free feel-good workouts because I believe that fitness should feel really delicious and feel good, not feel like torture. So I have 4 workouts that people can access. There will be a link that you will provide. And also, if you just go to my website, which is femfusionfitness.com, if you go to the main page, there's a big thing that says click here. You really can't miss it. It's under the big picture. That's going to get you those 4 free workouts. There's also a link that I'll provide you where you can get 2 chapters of my book for free. So that's all on my website on femfusionfitness.com.
Excellent. Thank you. So listeners, check out femfusionfitness.com and tune in for our next Couch Talk episode. Thank you all for joining us today. Spread the word. Claim your anatomy. Thank you, Dr. Brianne Grogan.
Thank you so much.